Well, daily coronavirus cases are rising again across much of the country. Infection rates are up in 36 states, including Wisconsin.
This comes as the FDA warns of a possible rare neurological complication for those who got the one-dose Johnson & Johnson vaccine. As always, we have lots to talk about with UW Health Chief Quality Officer Dr. Jeff Pothoff. Welcome back.
Hi, Dr. Pothoff. Good to see you.
How are you guys doing? I'm good.
Well, with the J&J vaccine, how worried do people have to be about that who may have had that one dose?
Yeah, so the good news is not that worried. We're getting really good at discovering very rare adverse events from vaccines. And Guillain-Barré, which is the one that has been making the news lately, is something that doesn't happen very often to people get vaccines, but we have seen this before with other vaccines. But still, the risk of having an adverse event from a vaccine is really low. The risk of something bad happening from COVID is much higher. So really not a lot of concern, just something for healthcare professionals and people to be aware of.
All right, that's reassuring to hear. Can I get your assessment or evaluation of, based on where vaccination rates are right now, where we are right now? Because it certainly seems like everyone is acting like, well, the pandemic is over and we're getting back to normal. It's almost as if the pandemic never happened. You look at crowds outside of the Deer District at the Bucks games, and it really seems like it didn't happen. And then you look at recent headlines about infection rates rising and cases rising, and it's alarming. So where are we?
Yeah, Susan, so you're right. So I think, what happened is we were locked up for so long that once the good news started to come, it was misinterpreted as good news for everyone. And if you look at vaccination rates, clearly there's many more people than those who are vaccinated who've gone back to normal, and that introduces a risk. Even with the Deer District, it's certainly outside, that's good, but if you're 6 inches away from the next nearest person and those folks are unvaccinated, that's where transmission can happen. We could see cases come out of that. Now hopefully we have enough folks vaccinated where we don't see big spikes, and hopefully the outdoors offers us some protection, but there is some risk with kind of this laissez-faire attitude of like we can just all go back to normal. If you're unvaccinated, that's still risky.
Yeah. Does that mean, based on all that, do we have to brace for another difficult fall then?
I do think you're going to see this continued rise in cases, and you're going to see it more often in areas that have lower vaccination rates. And I don't think it'll be as bad as last fall, where hospitals are on the brink of collapse just because we do have enough people vaccinated to probably stem that off. But I do think in some parts of the country you may see individual health systems or certain locations have a real tough time struggling with a lot of unvaccinated people getting really sick with Delta variant.
Do you think everybody who wants to get a vaccine at this point has gotten a vaccine? I'm wondering how much persuasion is possible at this point.
Yeah, certainly the going is slow, but even in the emergency department, I run into people who I ask them if they're vaccinated and they say no, and I'm like, can I get you signed up? And they're like, well, if it's that easy, sure. So I think there's still some people out there that we can work on, and we shouldn't give up, but the going is not easy. There isn't this clamoring for a vaccine right now, so that could be a problem.
Yeah. Well, and then turning again to fall, the CDC is saying no masks for teachers and students who have been vaccinated. Any thoughts on that?
California reversed that today. Did you see that?
No, I didn't see that today, but I think there's two things. So from the pure science of it, if you're vaccinated and you're going to school, kid or teacher, it's okay to not be masked. But the corollary is we have a lot of kids that'll be going to school that will need to be masked because there's not a vaccine yet available for them. And I think when you then give that guidance to a school, it's difficult because how do you know who's vaccinated and who's not vaccinated, who needs to wear a mask and who doesn't? And sometimes it's just easier to say, we're going to wear masks until everyone in school has a chance to be vaccinated.
A lot of good info. Thank you, Dr. Pothoff.
Yeah, you bet.
Every week we say, well, are we still going to be talking about this? And it's a good thing that you haven't gone far. Great to see you, Dr. Pothoff. Thanks for your time.
We'll be right back.